Right. Hi, guys. We are Group 12, and I'm Rachel.
I'm Morgan, and we're going to be talking about patellofemoral pain syndrome with an exaggerated Q angle.
And we are in the union, so hint the masks. So yeah, let's show you our presentation. Okay, so this is the cover page. So our case description is a 16-year-old female cross-country runner postseason, and she is experiencing severe medial knee pain with an exaggerated Q angle and is diagnosed with patellofemoral pain syndrome. Patellofemoral pain syndrome is anterior knee pain that is usually experienced by young female athletes and is similar to patella tendonitis, which is like jumper's knee. An exaggerated Q angle is also a cause or sign of patellofemoral pain syndrome. And we have a video provided that shows how to measure Q angle.
Measuring the Q angle can give us an idea as to the Q angle stands for. Follow the quadriceps angle on the tibia. So the landmarks that we're going to be looking at first are the ASIS, the midpoint of the patella, and the tibial tuberosity. To get an accurate measurement, we actually want to get where the tendon inserts onto the tibial tuberosity. So we simply have the patient contract their quadriceps like this before. We make sure that that is where it attaches. So we put a dot right in the middle of where that patellar tendon inserts onto the tibial tuberosity. Next, we palpate all the corners of the patella, and we simply put a dot right smack dab in the middle, and that is going to be our axis point. So now we take the goniometer and we place the hole of the goniometer or the axis right in that mid patella. We line up the superior arm in line with the ASIS. What I usually do is I have the patient, if you can put your finger right at the tip of that bone for me, and I can line that up, and then the inferior arm lines up with the tibial tuberosity point. And then from that, we can actually look at the measurement, and she has a measurement of 12 degrees.
Okay, so that was the video that shows measuring of Q angle.
Next, we're going to talk about signs and factors of patellofemoral pain syndrome. One of the factors that was presented to us was severe medial knee pain and an exaggerated Q angle. Some of the signs are localized anterior knee pain that is brought up by activities like running and squatting and even walking up the stairs. Another sign is tenderness along the patella border, and this pain happens gradually. Knee hyperextension is also a sign. Lateral tibial torsion is also another sign, and IT band tightness and hamstring tightness is also a sign of patellofemoral pain syndrome.
Zoom in on the picture. So some rehab goals for our patient would to obviously get the athlete healthy and back to cross country, to strengthen her quadriceps and VMOs and her hip flexors and adductors, stretch the tight areas like the IT band, the hamstrings, and the gastrocnemius muscles. Perform a combination of closed and open kinetic chain exercises, and overall just include proprioceptive training, which is like the progressing of the patient back to normal activity. So since this athlete is postseason, we thought that the stages would be the second through the final stage, which the second stage is the repair phase, which basically involves like the patient still has swelling and is experiencing pain, which she is on the medial side of her knee during movement. And then the third phase is the remodeling phase, which includes experiencing less pain with movement as the fibers are developing. So usually reducing the inflammation, and basically knee movement is a lot easier for the patient. And then finally, the final stage is ongoing repair and remodeling phase, which basically intends for the athlete to begin returning back to play, but she is also doing rehab for her best interest and to like limit the possibility of her patellofemoral pain syndrome to increase again. So the main goal is for, since the patient is postseason, is to focus on getting healthier, and yeah, this is why we chose these stages.
Next, we're going to do rehab exercises. And because the hamstring and the quadricep are both tight, we are going to stretch both the hamstring and the quadricep, both legs, and you want to hold it for 30 seconds on each side. Then you're going to have the athlete sit on a rehab table and do quad squeezes for quadricep strength. And you want to do 4 sets of 10 reps, and you want to hold each rep for 1 second on the injured leg. And then we are going to do clamshells and glute bridges, and you're going to do 3 sets of 8 reps for both of these exercises. Another strengthening exercise is going to be straight leg raise, when you have the patient lay on their back, and you're going to have them bend the knee that isn't injured and then keep the injured leg straight. And then you're going to raise the leg as far as you can without pain, and then do 3 sets of 10. Exercises continued. You're going to do knee extension with an elastic band around the injured leg. And you're going to start with the knee bent, and then you're going to extend it all the way back as far as they can. And then you're going to do 3 sets of 10 reps. Another exercise is going to be wall squats with a ball, and then 3 sets of 10 for that. And then our final exercise is going to be step up and step downs onto a block. And you want to step up and step down on both the injured leg and do 3 sets of 10 reps.
And I would like to add that these exercises are all progressed from easier to harder. So yeah.
And here are our references.
Oh, whoop.
And then here are our references.
So yeah, that's our presentation.